know, the foods that we eat contain various nutrients that are absorbed and used by the body. Some elements of the food, however, cannot be used and are eliminated as waste material. Hi, I'm Kathy Getrust, and I'm an instructor in community health nursing. Today's topic of discussion is on bowel elimination. Waste products are eliminated through one of four different ways. First way is through the skin. Waste is removed through the perspiration, also called sweat, from the skin of our body. It's also removed through the lungs. As we breathe out, we are removing waste with each breath that we exhale. A third way that we remove waste is through the kidneys. Through the urine, we remove waste from our body. And finally, the bowel removes waste from our body in the form of what's called BM, or a bowel movement. Feces is another term that's used for that. Sometimes you will hear people talking about stool, and a real fancy word called defecation. Defecation simply means the process of removing waste material from the body. Let's talk a little bit about the structure and function of the lower gastrointestinal system, also known more commonly as just the GI system. When the stomach finishes mixing and churning the food, it moves it on to the small intestine. The small intestine is much like a long rope. It's approximately 22 feet in length. And what happens to the food in the small intestine is that it continues to become more liquid in form and then gets absorbed into the bloodstream in the small intestine. When in the bloodstream, it goes to all portions of our bodies to provide energy for growth and development. What's left of the material from the small intestine then moves on to the large intestine. Another word for large intestine that you'll hear is just called the colon. The colon is much smaller, shorter in length. It's only about 5 to 6 feet long. And what happens primarily with the food there that has remained is water is absorbed into the bloodstream and is retained by the body. And what's left of the waste is then moved along through the rectum and out the anus in a form called feces or stool. There are some common characteristics of stool. First, stool is about 3/4 water and about 1/4 solid material. It's composed of about 30% dead bacteria and 70% undigested roughage. The normal color, as you know, of stool is brown. It gets the characteristic brown look from bile that is secreted from the gallbladder and is in the waste material prior to removal from the body. The characteristic odor of stool is produced by actions of the intestinal bacteria that are in the food that we eat. There are a number of factors that affect bowel elimination. The first one that we'll talk about is age. There are muscular contractions in the intestinal system that are responsible for moving the food along through the digestive system. It's much like if you squeezed a tube of toothpaste and moved the toothpaste along. With each one of those squeezes, a little bit more of the toothpaste, or in this illustration, food, is moved along through the tube-like intestinal tract. As we age, those contractions slow down and are not as forceful, and as a result, the waste material does not move through the intestinal system with the same speed as it did at a younger age. Diet also affects our bowel elimination. Fiber, which is the undigestible residue in the diet, provides bulk in the fecal matter and keeps things moving along. Time and privacy are also important factors in bowel elimination. Bowel elimination is a private affair. It's a very sensitive function and requires time and privacy for the intestinal muscles to relax and allow elimination to occur. Physical activity also promotes intestinal motility or movement in the intestines, and that helps move the stool along. That means that patients that spend an awful lot of time in bed or have a sedentary life, sitting primarily in a chair if they are up out of bed, in those instances the whole contractions of the intestinal tract slow down and move more slowly. And as a result, the passage of stool is slowed down through the system. Fluid liquefies the stool so it can pass more easily through the intestinal system. That means that a patient that has a decrease in their fluid intake will have a slower passage of food through the intestinal system. And conversely, for people who have an increase in fluid intake, will have a speedier passage of stool through the bowel. Positioning is also a factor that affects bowel elimination. Bowel elimination normally occurs when we are sitting upright. Any illness that prevents placement of a patient in a sitting position, such as someone who might have had back spinal surgery, it reduces the ability for them to empty their intestines of stool. Some medications, such as narcotics, opiates, antacids that contain aluminum, will also decrease the intestinal activity. Conversely, medications such as antibiotics can cause an increase in the intestinal activity because antibiotics can disrupt the normal bacteria that are in the intestinal tract. Maybe you've had the experience, or someone you know who have been placed on antibiotics have had difficulty in that they've developed diarrhea along with the antibiotic treatment. Conditions such as hemorrhoids, certain types of rectal surgery, or childbirth can cause pain during defecation. To avoid pain, the individual often will suppress the urge to have a bowel movement. This suppression of the urge causes the waste material to remain in the intestinal tract for a longer period of time, making the stool harder in consistency and devoid of quite a lot of water. Chronic bowel diseases such as diverticulitis or inflammatory bowel disease or other diseases can affect bowel elimination as well. The nurse will let you know if you have a patient with any particular type of chronic illness that you need to be concerned about. Stress also causes an increase in bowel activity initially, but if stress becomes chronic, bowel activity will slow down over a longer period of time.